welcome to Chris Chicky Supply Company, guys. You just call me K. Today we're going to be going over some medical considerations. It'll be a part of a longer form series that we'll be doing, but today we'll just be talking about basic IFAK. Many of you, I assume, are either military, law enforcement, or military hobbyists that have kits at home. And making sure that you have good medical preparation is the biggest thing for a lot of you. You're not always going to have medical teams on standby to help you out, so having the proper kit and the knowledge of what those things are is going to be very important for you. So first off, we're just going to go over essentially IFAKs. So the most common that you'll see, especially in the military, IFAKs are pretty standardized, issued out, and they all contain the exact same thing. They follow the TCCC standard of what care under fire or basic combat care looks like. And this is going to be a little bit different than what you'll be issued exactly in terms of the case itself, but the contents will be the same. So for myself, I have a med roll in the back. That's more of a complement to the rest of my medical gear, but that's a unit SOP policy. So I come from the military. I've a number of years in emergency medicine as well. A lot of what I've done is bridge that gap, but I still have to stay within certain SOPs that we have. So that primary one is that IFAK in the back, small of your back, along your belt line. So depending if you are military law enforcement, you might have to abide by those SOP considerations. But a lot of that comes down to ease of access too. So if you're not abiding by SOP considerations, that's still a great place. It's easily accessible with both arms in the event of an emergency. Whether one arm goes down, you can still reach it no matter what. Also standardizing it among everybody that you're with and making sure that they know where yours is if you're not all in the same location. But for my unit, the first primary IFAK, that basic TCCC IFAK, is going to be the lower portion of your back, either in a roll pouch like this or that traditionally issued IFAK container itself. So what you'll find in a issued IFAK ranges a number of problem sets, right? So first off, we'll start with hemorrhaging. You'll find your combat gauze, traditionally known as Israeli bandage. That's just going to be a pressure bandage that you guys will see. It'll be a collection of a few different components, but what makes it extremely important is going to be the pressure bar that's in here. That's going to apply that direct pressure to a location that you can't use a tourniquet on. So that's going to be one of the most important things that you guys are aware of and carrying. You'll also be issued a couple sets of gloves. That body substance isolation is very important. You also have or should have a pack of just regular Z-Pack gauze, whether you're using that to wrap pretty basic abrasions or avulsions, or you're packing the wound itself in conjunction with that Israeli bandage. That's something that you'll have there. And if you're not being issued any of these things, these are the basic things that you should have. Additionally, you'll also be issued 2 tourniquets. For myself, I carry one on the lower portion of my kit on the med dangler that I have. And then for the rest of them, unit SOP is left ankle pocket and right shoulder pocket on our combat tops or field tops. Going into Airway, there'll be a few different things. They're a little bit complicated depending on your medical skills or training, but the most basic ones are going to be your chest seals, which are going to come in a pack of 2. So that's for any penetrating wounds to the thorax. And then in conjunction with that, you also have a nasopharyngeal airway. So just basic airway protection in case of any incidents in the field. That's very important. Establishing patent airways is that first line to patient survival. Depending on who you're with, they might issue you an NDC or a needle decompression needle. That's essentially to alleviate tension in the thorax. You call it tension pneumothorax or tension hemopneumothorax, just depends on what the underlying issue is. But having some kind of decompression needle to alleviate any pressure in the thorax is important to restore good breathing, good airway control. So those are your basic things, along with a TCCC card. Pre-filled out, it's very important. Whether you are military, law enforcement, or civilian, it doesn't matter. Having a card to document injuries and treatments, times, everything like that is extremely important when transferring to a higher echelon of care. You just be at the gun range, right? You have some kind of issue, you treat it. Those paramedics or that flight helicopter that comes in, or that air ambulance that comes in, needs to know exactly what you guys have done. So it'll have your blood type, name, your interventions, and all that needs to be relayed to the next echelon of care so they can continue and know what's been done. So that's really your basic IFAK that you guys should all be having or be issued. Knowing what's in it and having constant training with them is very important. In terms of considerations for your kit, right? So where you're placing it. So like I said before, for these basic IFAKs, right, the TCCC standard, lower portion of my back. In that case, if my right hand goes down, I can still pull it from the left side. Left hand goes down, I can pull from the right side. Everybody on my team has it in the same location, so we all know where it is on everybody, right? IFAKs are not to be used for your buddy. Your IFAK is for you specifically. So knowing where it is on your body, your team can approach you and begin to treat. If they don't know where it is and they end up using their own, they're going to be in a shit show later on. So making sure everybody knows where it is and making sure that's standardized is extremely important. Obviously, this is just the very basics, right? This is your bare minimum. Obviously, you want to increase your medical capability for any other situations, especially if you get into a more austere environment. But we'll go over that in a separate video as we start to build out everything that I carry and everything that's recommended to carry if you are 2 hours away from medical care or 24 to 48 hours away from medical care. Prolonging that ability to treat a patient is extremely important, and the longer you go, the more complications there are. So that's just something to keep in mind. That's about it. So next up, we'll be going through pharmacology, airway, and regular hemorrhage control, as long as the underlying issues that might come out of that, whether that's sepsis or shock. So catch those in the next videos.